Hi, I'm Dr. Adam Ellison. We've been talking a little bit about hip replacement surgery. And I want to talk about the approach. This has actually probably garnered the most discussion in any of the orthopedic conferences when we talk about hip replacements over the last few years. And I've tried, I think, every hip approach out there, and I've now using one that I'm just really excited about and I think is making a big difference. As far as I know, I'm the only orthopedic surgeon in Alaska that's offering the superior approach to the hip, and that's an approach where you come in from the top of the hip rather than the back or the front. So you may have heard of like the posterior approach to the hip. This is the most common approach still done in the country. About 60 to 65% of the surgeons in the U.S. are still doing hips through the posterior approach. It's been working for 30 years. It's had fantastic results. And people have done just phenomenally well with the posterior hip approach. However, a few years back, people started doing more of an anterior approach, which became very popular. And the reason for that is the anterior approach was getting people up on their feet quicker. In the end, if you look out 2 months out from your surgery, you're going to have the same result whether it was posterior or anterior. However, it's the quickness with which people got up and moving and walking through that anterior approach which made it popular. And some of the surgeons have converted over to doing that anterior approach to the hip. I started out my career doing posterior approach for many, many years and then converted to the anterior. And I had a few issues with it. I had patients that it went well with, they did phenomenal. They got up and moving very quickly. But there was a lot of issues that I ran into that I didn't really like the approach very much. One of the biggest issues is the incision is right down the front of your hip, and it generally goes over your groin. And that's a place where you have a lot of bending, and so you're putting incision right in a place where when you sit up, your skin is just kind of folding over it. So the anterior approaches seem to see a lot of issues with the wounds. You can get a lot of wound breakdown, and when you have a joint in place, the last thing you want is to have a wound breakdown and get an infection into a total joint. That's an absolute disaster. And so, that was a huge concern that's just not a great place to put your wound. I also had a lot of patients that end up having numbness on the outside of their leg. There's a nerve that kind of comes right by that surgical field or right through it. And so we have to move that out, and that's a very common complaint, and a lot of times that's permanent. And so I saw a lot of patients, not of mine, but people have had anterior approaches elsewhere, and some of mine that had some permanent numbness on the outside of their leg from previous hip replacements, and that bothered them. And the chance of getting some permanent numbness for an approach that may make it better the first month or so is just. It's a lot. And as I looked at this, and also as you come in through the front, the quad muscles, you kind of have to remove some of the quad muscles, and I saw a lot of people with weakness in that quad muscle directly after the hip replacement, and that was tough. So and there's a few other ones too, but so I was getting frustrated by the amount of complications I had, and I started researching the anterior hip more. I found that surgeons across the board have a lot of complications with this. I was looking at studies where surgeons that do more than 300 hips in a year, which is a lot of hip replacements per year. So they're very good. They have this surgery down. They know it very well, and yet they're still seeing about a 12% complication rate, which is for me was just too high in a surgery. And then I learned about this, what is called the superior approach to the hip, and I took a couple of trips down the lower 48 to investigate this further, and I have just been doing this a little bit over a year now and just love this approach to the hip. And the basics of it doesn't come in through the front or the back, but basically we come to the very top of the hip and make an incision up there. With the assistance of a portal, it makes our incision about 3 inches. So it's about half the size of the incision of the anterior approach to the hip or the posterior. So we have a smaller incision. It's up on kind of the top of the buttocks, which is a great place for healing, where you don't get any folds of the skin, and so it would be very rare to see any healing or wound issues in that location. Because you're not coming in through the back where you disrupt the IT band and the short rotators of the hip, you bounce back quickly, and so you get back up in your feet a lot quicker, like the anterior approach to the hip. without all the complications of it. So I've been able to perform this now in the outpatient setting here over the last couple of years, where we were able to get patients up on their feet, within a few hours of surgery. We were able to get them to go up and down some stairs, and we get them home about 6 hours after surgery. They're spending their night in their own bed, able to take some pain medicine, not having to wait on a nurse to bring it, and the response has just been phenomenal. Patients have loved being able to go home. They seem to be more comfortable. They never experience as much difficulty as those that are staying in the hospital. So I've been excited about that approach, and I think it offers the patients a lot. The stability of that approach is also great. When you dislocate, you either dislocate out the front or out the back. You don't come out the top. And by going from the top, you don't really disrupt the structures in the front or the back. And so I think our stability is fantastic with the approach. We don't have the nerve problems and issues, and knock on wood, I haven't seen any complications with it as I've been doing it over the last year. So just had a lot of really happy patients, and now with this new approach to the hip, it's become one of my favorite procedures because it's been so reliable and patients have done so well with it. So please look up if you want to a little bit more about the superior hip approach that we're doing, and if you're interested in talking more about it in person, feel free to send my team a note here on the website. We'll get you scheduled for an appointment. You can call OPA and ask to speak with Dr. Ellison or one of his team, and I can talk to you about this superior approach to the hip and potentially even this outpatient surgery options that we have that I think right now we're the only surgery center in Alaska offering patients true outpatient total joint surgery. That have been established for a couple of years now with great success. So come visit us, and we'd love to talk to you about your orthopedic needs and what we can do to get you back up and active like people here in Alaska want to do. Thanks very much for stopping by.